We've had the privilege to care for world-class ballet dancers who unfortunately sometimes land from a jump in an awkward position, rupturing their knee joint ACL.
I'm a ballet dancer and an instructor, and I tore my ACL, unfortunately, during one of the practices.
In the past, this was a devastating injury for the ballet dancer, loss of motion, lots of pain, long recovery program.
I was scheduled to have a surgery using my own hamstring, and I just didn't feel like I was comfortable using my hamstring. I came across Dr. Stone's clinic and I really liked their approach, and I liked the fact that they would use a donor tissue to reconstruct my ACL, and I liked all the advanced methods.
We're able to repair the ACL or reconstruct the ACL using donor tissue immediately after the injury, and have the ballet dancers see their line in the recovery room, immediately gaining their full range of motion.
Physical therapy is very important, and I feel like those people are just doing a great job. And what I like the most is that they would push me more than I think I can be pushed. And I am very pushy.
The care of the ballet dancer has changed dramatically over the last few years, so that these world-class, beautiful dancers, artists, athletes can return to their art form as soon as possible after what used to be a devastating knee injury.
I'm just very, very happy that I came here, and I feel very lucky.